Hello and good morning, everyone. This is Michael Webb, the interim program manager for the K through 12 schools grant. I'm happy to say that we are not having the same technological difficulties that we had last week. So thank you for your patience. And in the interest of your time, we'll go ahead and move forward with the presentation. This is the PCHD School Health Update for Thursday, January 19th. 2023. Our agenda today, we will take a look at some brief announcements, review community rates and transmission of COVID-19, flu, and RSV. We have a special guest today, Matt Christenberry from our EPI team, who will be sharing some information about disease reporting and how the PCHD EPI team can help you. And also excited to announce that we will be integrating a Q&A into each of these meetings with an epidemiologist so that all of your questions can be answered live through the chat.
Michael, you're on mute. Michael, I'm not sure if you can hear me, but you're on mute.
Can you hear me now?
Yep.
Hopefully you heard all of the first part.
We heard slide one. Yeah, slide two, it went on mute for some reason.
Strange. Okay, maybe changing slides put me on mute, but I'll monitor that when I switch to the next slide. Thanks, Matt. All right, so I'll start at the top of this slide. So just a few brief announcements. We do have Narcan available for all schools. If you're interested in getting this for overdose reversal, opioid overdose prevention, you can surely reach out to school support at pima.gov. Also available through our community mental health and addiction team, we have fentanyl presentations for staff, youth, and families. Please do reach out if you're interested in either of those. We also have COVID test kits. Excuse the holidays. I'll take that out. And hopefully you all had a wonderful, restful break. We do have COVID test kits available, and they're available to pick up at the warehouse. Just as a reminder, many of these are expiring in February 2023. So as you're monitoring your stock, just make sure you're looking at that expiration date. And again, if you have any questions, reach out through school support at pima.gov. We're happy to help. Now, with the spring, is the perfect time to start thinking about scheduling a COVID-19 vaccination clinic at your school for staff and students. Our vaccine equity program is equipped with nurses, community health workers, health navigators to come out and provide a comprehensive experience, whether it's for folks who want to get the vaccine and know that right out the gate, to have conversations about vaccine efficacy and safety. And they would be happy to get scheduled with you. You can certainly reach out to them at vaccine equity scheduling at pima.gov. All right, shifting slides. Let's see if it mutes me. It certainly does. So Matt, I don't know if that'll affect you or not, but now we know. So just as a reminder, as we move into the spring, if your break was restful, but maybe you could have used a few more weeks, just want to remind you that there's our emotional wellness presentations for staff and students available through Pima County Health Department and our collaborators. These topics include practicing mindfulness, managing stress, trauma-informed care, PACS tools, and Text Talk Act. And I'm going to invite you all to join me in the digital age. If you have your smartphone and you're interested in just reading some descriptions about these workshops that are available and potentially signing up, if you take out your smartphone, open up your camera, and scan that QR code there, that will take you to the appropriate website for signing up or researching if any of these could be useful for you. All right. So Matt, do you want me to go over the slide or do you want to take it from here?
No, I'll take it from here. No worries.
All right. I feel like when we have an experienced epidemiologist, it probably comes better from you.
Well, thanks, Michael, for having me on. And good morning, everybody. As Michael mentioned, I'm Matt Christenberry. I've met a lot of you probably through phone calls and talking about investigations that we've had for students, for staff members through COVID or other infectious diseases. But I've been an epidemiologist here at the health department for a few years, but I currently oversee our epidemiology intelligence unit, primarily focused on outbreaks, COVID-19, and emerging health threats. Oh, we lost this. Oh, there we go. Okay. Yeah, so a lot of these slides I'll go over are not anything that's new to you all. Some of these data points are just going to change, but the information is going to be kind of the same. But we have the two metrics that we look at. We have the community level, which is in the low status, the green, which is very good news. We continue to see our case counts trend downward since we've peaked in late November, early December. But if we look at the rate of transmission, we're still in that high level. Again, that metric is really more utilized or more meant to be utilized by our healthcare facilities. But if we look at our last week that was completed, we had 111.8 cases per 100,000 people, which was actually 29% increase, and our positivity rate was about 13%. And that also went up a little bit. But our case numbers did go down this week. And as we know, the CDC updates these levels on Thursdays, usually Thursday afternoons. But also we know about 21% of those 5 and older have received the updated bivalent booster. So hopefully we'll continue to see those numbers kick up. And as Michael mentioned, we have those clinics available. So we continue to push that messaging and hope that people continue to get that updated bivalent booster because that's going to offer the best protection against current circulating strains of COVID-19. Next slide, please. And this is just a map of the U.S. that shows the current community levels. As you can see, there's a lot of green, which is good news. We still do have some communities, especially more on the East Coast, that are in that high level and a lot in medium. But again, we're still in that green level. And as you can see in Arizona, we have just the little corner up there in the top that's in yellow. So that's good news. And hopefully we will be in green come today when there's an update. Next slide, please. And again, we just like to ensure that everybody on this call understands how those metrics are shaped by the CDC. So we can look there at the case counts, and we look at the case rate, and then we look at the admissions for hospitalizations and the inpatient beds occupied by COVID patients to determine what the level should be. And again, this slide just kind of highlights those 3 metrics: the case rate, which I mentioned earlier, and we also are at the 6.5 hospital admissions per 100,000 population for COVID-19 patients. And then 4.7% of the staffed inpatient beds are used by those with confirmed COVID-19. Next slide, please. And then again, this is a similar map just showing the community transmission, which again is a lot different of a color because the metrics are different. The bar is a lot lower to help inform our hospital partners and our healthcare partners about the transmission so they can make better informed decisions on prevention and mitigation efforts inside their facilities. So again, you can see here that around 71% of the U.S. Counties are in that high transmission level. So we are still, unfortunately, seeing a lot of that, but that number will probably be high for a while unless cases continue to trend downwards significantly, which they are decreasing, so that's good news. Next slide, please. All right, so a couple of new slides to go over today. So influenza or flu, as many of us call it, we wanted to touch base on this because the respiratory season has been very interesting this year. And even the last couple of years, it's been interesting for a few reasons, but particularly this year. So I'll reference the 2022-2023 season, which starts usually at the beginning of October. So for this year, it started the 2nd of October, and we have data through the 14th of January of this year. So In Pima County, we're nearly at 3,000 cases, which is about 3 times higher than the last 5 years. So we take the last 5 seasons and we average that out to get what we would typically see. Typically, we see about 1,000 cases up until this point. And about 28% of the cases that we have seen have been among those that are 5 to 18 years of age, which typically represents the second most flu cases for age groups. And as you can see there on the right, there's this epi curve, which the blue shade is the current year. So you can see there in like late November, we had a really high peak, and then the gray bars are a little harder to see, but those typically peak at the end of December. So as you can see, this last week, 1/8/23, so that's MMWR week 2. You can see that the blue line is actually a little bit lower than the gray line there. We had 138 confirmed influenza cases, which is actually about 0.8 lower compared to the last 5 years. So just a little bit of a decrease. Even if we look at the last 2 weeks, so MMWR week 1 to 2, we actually saw about a 34% decrease in those confirmed cases. And also 91% in the last week were type A, because some samples do get sequenced and typed. So we are seeing that there. So good news is we are trending downwards, but bad news is that we still are 3 times higher this year than we would typically see. But hopefully we'll continue to see that trend go downwards. And the flu season will hopefully wrap up earlier than we would typically see. Next slide, please. And also, we want to touch base on RSV. Again, this RSV has been an interesting year, as we all know. It's definitely been winding down, but again, we'll look at the same timeline because we look at our flu and RSV seasons on the same timeline. It doesn't go by calendar year. So again, we've had about 1,300 cases here in Pima County, which is 6 times higher than the last 5 years up until this point. Typically, we only see about 231 cases. And very similar to what I reported with flu, about 33% of the cases have been among those 1 to 4 years old, which typically represent the second largest group. So that usually those under 1 represent the largest percentage of cases. So we saw a little bit of a shift this year. And there's some suspicion that that age group has obviously drove the higher cases just because of the pandemic and maybe people not getting exposed to RSV, because we know that a majority of kids by the age of 2 to 3 are going to get RSV, just because that's just a very common pathogen that we see and kids get infected with. But again, if we look a little bit more granular at the current MMWR week, which again is the January 8th to the 14th, we had 53 reported cases, which is about 1.6 times higher than what we'd see for the last 5 years. So again, that pink bar is what we'd see for this current year, and the gray bar, similar to the flu chart, is what we've saw for the last 5 years. But we did see a 31% decrease if we look at MMWR weeks 1 to 2. So as you can see, we've been trending downwards. It hasn't gone down as quickly as it went up. But again, we are getting, we do get some anecdotal reporting from our hospitals about their capacity and what they're seeing. And when we were surging with the numbers, we were seeing a lot of hospitals that were reporting, a large volume of people visiting the ER and ultimately getting admitted to the hospital. Things have been slowing down, but there's still a lot of activity that we're seeing in the hospitals. But the good news is, again, we're trending downwards. So next slide, please. All right, so to switch gears away from data, we know that there's a lot of newer staff that working with our wonderful schools, but so we just wanted to kind of highlight a few things for our partners on the call. So we actually have, there's some links that are in these slides. They're grayed on this, but when you get the slides, you should be able to click the link. So we just wanted to go over disease reporting. So on the right here, you see a little screenshot, and this same screenshot is embedded on that azdhs.gov page. And that goes over these questions I have highlighted here. But again, we have a lot of different diseases in the health department. We're responsible for monitoring and responding to over 90 reportable diseases. So when I say 90 reportable diseases, that's generally for providers and laboratories. And our schools, they, as you see here, have a lot less of required reporting diseases. And so you'll see in this list here what is required to report. So if you're not certain, this link is really great. So you can say, okay, well, what do I need to report? For example, we all know like pertussis, you got to report that if you get a report from a parent. And again, so the schools are required to report that, but a lot of times it's you people on the call that are reporting that to us. So those working in the health office or an administrator will be reaching out to our epi team to report those cases or those suspected cases to us. Also, that this nice screenshot on that page will show you what's the timeline for reporting and how do you report it? So some diseases you got to report really quickly. So within 24 hours, you should give us a call, reach out to us, and let us know. For example, like a mumps or measles, that's a really urgent situation. So we want to be aware of those things. But some diseases have a little bit of a longer timeline on there, so 5 days. And also some diseases may only be required if there's a suspected outbreak. So if you have an outbreak of pink eye, for example, that would be something you'd want to reach out to us and let us know about. But also we're happy to get reports for other things that aren't on this list. Some of you on this call know that we're there to support the schools and the teams if they suspect or see anything that's unusual. We're always happy to kind of talk through things and help navigate situations that may arise. So how to report, and again, both of these forms that are highlighted here, this CDR is what it's abbreviated as, but it's the communicable disease reporting form. And there's also a communicable disease outbreak report form. Both of those forms are hyperlinked, but they're on that school reporting page, so you can download them, you can fill them out as a PDF, and you can. There's a couple ways that you can send them to us, and I'll cover that on the next slide. So next slide, please. Or I should say 2 slides from now. But I think this was a really important thing to highlight for some of you that are newer. Again, AZDHS, which is the state health department, they offer a really great mobile app. And this is really designed for the school nurses, health aides, and childcare staff. It has a couple things in it. For example, on the EPI team, we use the flip chart that's embedded in this app a lot for just as a quick reference resource for things like, oh, what's the common symptoms of a certain disease? Again, it's just a quick reference. So you can download this mobile app. Of course, check with your district if you have if you have a work phone or things like that. But this is a really great app just to have available, because you can see on the right there's a screenshot. It has that flip chart, but it has an injury flip chart, vaccine information, and prevention for infections in there. So again, it's just a great resource, and you can find that by clicking on this link here on the slides. It'll take you right to it, and it'll give you instructions about how to download it, but also what is available there. Next slide, please. And so a lot of you know how to contact the Pima County Health Department EPI team. But again, just to make sure, because things have changed, our team has grown quite a bit over the last year. But we have an email. It's simply just epi@pima.gov. You can shoot us a quick email if you have a question. That's going to be one of the best ways to get a hold of us, because we check that regularly. You can give us a call. We do have somebody that answers that EPI phone number that actually changed a couple months ago. So if you call that number, you should get somebody. But again, if we're getting a lot of calls, we may not answer it and may go to voicemail, and then we'll return your call. So again, if you just have a question, you can send us an email. I always remind people, if you're sending an email, try to utilize encryption if you're sending something that needs to be secure. So you're not sending protected health information over email that's unsecure. But we do have the old-fashioned fax that we still utilize. That's still utilized by a lot of our partners in the community. So you can send us over that communicable disease reporting form or the outbreak reporting form through fax. And I have a web link there. Again, that's our Pima County Health Department page that goes over these phone numbers and fax numbers and things like that. But you also may get you may be asked by our team, if we're working with you for an outbreak assessment, we may need some information like a line list. I know a lot of you have experienced that, and really, just for anybody that's newer, you may get a request for that. And a line list really is simply like a spreadsheet, and each row in the spreadsheet would be a person that's infected by the suspected disease that we're trying to investigate. And so when you open that AZDHS reporting page and you see that list of reportable diseases, on the second page of that handout, there actually will be some information there that says, what's required by the state to report to us, which generally is the same stuff we would ask for. So like names, date of birth, phone number, just other things like that helps our EPI team out to be able to complete our investigation, which may require reaching out to the student or the staff member or whatever the case may be. But we may provide you, for example, like a Qualtrics link, because we have this survey that we can utilize for schools to upload, or any facility to upload information securely. But also, if you don't have a secure email and you want to send it that way, we use Kiteworks at the Pima County Health Department, and we can initiate an email to somebody and they can reply back in Kiteworks, that will be secure as well. So again, there's different ways that you may get that. And I mentioned that our team has grown, so you may get other people calling you, like Anissa's on the call today. And her and I have worked with a lot of schools, but you may get calls from our other epidemiologists and our disease investigators as our team is growing. So we just wanted to say thank you for continuing to be great partners in these responses. And next slide. I'll kick it back over to Michael now. Thank you.
All right. Thank you so much, Matt. You are phenomenal. And I always appreciate someone who can make all the data and epidemiology sound really, really super exciting. You do a great job. Just so y'all know, as a reminder, uh, the next school's call will occur. Well, that's today, but the next school call will be 2 weeks from now, and we will move to the first and third Thursdays of each month. In the interim, please continue to contact PCHD for school support via email at schoolsupport@pima.gov, or you can call our school support line 520-724-7018. Some additional resources here, as well as some things that we talked about. And this will be available to you. So you'll be able to click through these links. And finally, we invite you to visit pima.gov/healthy schools. Again, there's that school support email and the school support phone line as well. All right. So I actually see a question in the chat for you, Matt. And so we'll take a few minutes here if anyone has any questions for Matt regarding any of the health related data that we reviewed. If you have questions about disease reporting, and of course, if you may have questions, but you're not quite sure or have formulated that question yet, you do have that EPI email. We want to make sure that line of communication is open for our wonderful school partners. So Matt, I can see Kathy has asked, do we know what the main COVID variant circulating in the county is? Has XBB.1.5 arrived?
Yeah, thanks for the question, Kathy. I'll first start by just kind of reminding everybody. So we do sequencing on various things, like for example, flu samples in some cases, but also with COVID. So if somebody gets tested with a PCR test, which is the more complex type of testing that's sent out to a commercial laboratory, gets processed. Some of those samples will get forwarded on for sequencing. Not every sample gets sent for sequencing. Again, it's just more of a sample. The antigen-based testing that we all know, for example, like the home-based test or the antigen card test that many of the schools have utilized, those tests get discarded right away, so they're not available to get sequenced. And we do know that the number of samples that have been sequenced over the last year have dramatically decreased, primarily due to the availability of these antigen-based testing. So, which is good news that the testing is more widely available and easily available. But the bad news of that means we don't have as much insight into the current circulating variants. So with that being said, in Pima County, it's very similar. The numbers have decreased. We've actually taken some initiatives to work with local hospitals, local healthcare partners, and even at our own testing sites. We've worked over the last couple months to try to increase the number of samples that can get sequenced so we can have better insight to what's circulating. And also just to know, one of the bad things about sequencing is it takes time. It's not like a test where you get a result and it's available right away. A lot of times the sequencing data can take 2 to 4 weeks from when the test was collected to be finalized and then input into the data. So that's also another limitation. Like we don't always know what's currently circulating like right now or even in the last week because of the data takes time to process. So primarily what we're seeing in Pima County, very similar to what we're seeing in the state, is still the BQ.1 and the BA.5. So we're still seeing Omicron, and then those types of sublineages are primary drivers. And I also like to look at, just so everybody knows, I like to look at the CDC page because they don't break it down particularly by like local jurisdiction. They do provide two larger scale ones. For example, they look at the regions of the U.S. So region 9 includes Arizona, California, and a couple other states. That provides more of an aggregate report because, again, the numbers are a lot smaller. So combining data together gives us a little bit better insight of what's circulating in parts of the country. And so if we look at that, for example, we know that in region 9, there's about the XBB first, that's about 15.8% of the circulating variants. And this also is based off of a little bit of projection from the CDC based on what they're seeing in the data, because again, there is a delay. So we try to better formulate what may be circulating based on the data. And then XBB 1.5 accounts for about, for about 15.8%, and then the XBB is 6.5%. So Arizona is very similar in those numbers. And for Pima County, we don't report out on generally less than 10 data points, but we've had less than 10 of those samples sequenced in Pima County. So, but I always like to remind people about, variants that are circulating that may arise. It's really important to know that as we continue to go through this pandemic, this response to the virus is going to continue to change. As people transmit, the virus is going to take that opportunity to change a little bit. And it may just change a little bit, or it may not change at all. But the good news is that, for example, the bivalent COVID-19 vaccine continues to offer a good protection against more severe disease, so hospitalizations and death. But also we still have good treatment available that does help prevent more progression to severe disease. So we'll continue to monitor the trends and patterns, but I think just keeping those things in mind is really important as we kind of move forward, because we're going to continue to see these changes. And that's why we want to continue doing this monitoring of these variants, because for example, like the CDC and the federal level will make decisions on treatment, like we reviewed the monoclonal antibody treatment because current circulating variants, the treatment is not effective against it like it once was. So it's really important that we continue doing the sequencing, and that's why we're continuing to try to increase the number of samples that get sequenced, so we can better inform, local data, but we can also inform the larger picture, so that data can be utilized to make decisions and inform, again, what happens on a larger scale. Hopefully I answered your question, Kathy. And I'm happy to share some links as well, just for anybody that wants to be aware, because the state does produce their own report for like statewide data. And then the CDC has some really great resources as well, that I think that might be useful for anybody that wants to keep up to date on those numbers.
Thank you so much, Matt. We'll hang out for just a sec to see if there are any more questions. Kathy, I can see your hand is raised. If you want to throw your question in the chat. Let's see. Kathy, let us know if you're typing a question in the chat. Oh, there it is. Perfect. All right. So, she says, thanks. Is there any talk of boosting after bivalent immunization?
That's a good question. As far as right now, people can follow the guidance for if they need a booster, like the normal, if it's been so long after you received your last booster, if you're eligible. For example, some people, they may already be maxed out, so to speak, on the number of vaccines that are available to them based on the recommendations from CDC. There could be changes to the guidance this year, for example, like to get your booster more frequently after you received the initial one, but nothing has quite changed on that front, to my knowledge, yet. But I think it's a really good tool the CDC has on their website. If people want to go on, they can punch in information about when they receive their primary doses and any boosters after that. Then that tool will let them know if they're eligible for a new booster based on their age and other factors there. I think that's a really important tool to have saved if anybody has questions about that.
Awesome. Well, thank you, Matt, for being here with us. We're looking forward to having the EPI team on these calls moving forward. Just a preview for next week, we will have a special guest from Text Talk Act, one of the resources that we previewed earlier, to talk about how that could be useful for your students and staff, and ways that you could integrate them into your school settings. And so excited to have Raquel from Text Talk Act. And seeing no more questions, I think we'll go ahead and conclude today's meeting. Thank you for spending this time with us and being partners with Pima County Health Department. Matt is going to throw some links into the chat here. And I hope that all of you have a wonderful and healthy rest of your day, and we'll see you in 2 weeks.